Hi, I'm Dr. Corey Rava, and today we're going to talk about the Kitty Kollar. This is an essential aid for cats and dogs when you have an esophageal tube in place.
So why would a cat or dog have an esophagostomy tube put in place? Well, it comes down to one of two reasons. Either they cannot eat or they will not eat. Cannot eat is typically there's something traumatic has happened to their mouth or their throat where they're unable to chew or swallow. The will not eat is a little less obvious. What happens with some animals when they get sick, and this is especially true with cats, they'll simply stop eating to the point where they'll actually make themselves even sicker. And then it's this self-fulfilling prophecy. They don't eat, they get sicker. They don't eat, they get sicker. We put these tubes in place so we can provide nutrients for them until they recover. Sometimes these tubes are in place for weeks or even months.
So first question to ask is why the need? Well, historically, we're going to wrap these esophageal tubes first with something that's absorbent, but then covered with vet wrap. And what happens with vet wrap when you have motion? It sticks to itself, and then it gets tighter. And tight things around the neck is not comfortable for the patient. Plus, as we all know, when you have vet wrap that's bunched up, it's really tough to remove. It comes in 6 sizes, so it's going to fit virtually every cat and dog. But if you notice the length of the Velcro, there's adjustability even within the size. The first thing that goes on the patient is the little protective pad. So this is basically an absorptive donut that goes around the tubing. You then place the collar in place, adjust the Velcro, and you're good to go. In addition, these are machine-washable, and this fabric does not catch claws nearly as easily as vet wrap does. These have been on the market for more than 15 years and used by most vet schools. The Kitty Kollar reduces complication and improves patient comfort.